Good evening. My name is Carolyn Stern, and I am here from the Center for Hearing and Communication. Welcome to our webinar tonight, Mental Health and Hearing Loss, a Conversation. CHC is a long-standing nonprofit organization based in New York City and Florida, where we provide comprehensive services to people of all ages who are hard of hearing or deaf and their families. What a year it's been. And tonight's program will discuss the impact of this past year on our well-being and also explore ways to take care of our mental health. The program has been a collaborative effort between CHC's Baker Family Emotional Health and Wellness Center and the American Foundation for Suicide Prevention. And we are grateful to AFSP for this important partnership. To start off, I'm thrilled to introduce Dr. Kate Salvatore, our moderator for tonight. She will lead the program from here on out. So welcome, Kate, Dr. Salvatore. Kate Salvatore is a board-certified child, adolescent, and adult psychiatrist. She has 20 years of experience in the psychiatry field. She currently works at Princeton University as the coordinator of psychiatric services at the university's health center. Dr. Salvatore serves as a consultant to the Eating Concerns team and the Crisis Intervention team. Dr. Salvatore has earned her medical degree from the Icahn School of Medicine at Mount Sinai and her Bachelor of Arts degree from Amherst College. Dr. Salvatore is a bilateral cochlear implant recipient. She's also a longtime friend of CHC and a close friend of mine as well. We met at CHC many years ago, and it's a pleasure to have you here with us tonight.
Thank you, Carolyn. I appreciate that introduction. It was very lovely. Thank you all for having me here tonight. I'm honored to serve as moderator for this panel. It should be a great discussion, and hopefully this will be informative for everyone. In terms of logistics for this webinar, I will be answering questions coming in live, as well as answering questions that were submitted during the registration for this event. So bear with me. I'm going to try and keep track of the questions, be mindful of the time, and also make sure that I speak slowly enough for the interpreter and the captioner. So let's get started. So, as most of you know, May has been designated Mental Health Awareness Month, as well as Better Speech and Hearing Month. These two topics are so important because they affect so many people. According to the National Alliance on Mental Illness, 1 in 5 Americans has a mental health condition. And with regard to hearing loss, the National Institutes of Health reports that 1 in 8 Americans ages 12 and up has a bilateral hearing loss. So both of these areas deserve plenty of attention during these challenging times. In terms of mental health, we have seen an explosion of information and stories from people all over social media. People are reporting unprecedented levels of distress. At my workplace at Princeton University, March 2021 was our busiest month on record. Students presented with a wide range of complaints, including depression, anxiety, social isolation, escalation of family conflicts, and sadness, as well as anger over disrupted career plans. Raising awareness and educating the public about all of this is critical so that people can get the help that they need. And especially now that we're all reappearing from the shadows of COVID-19, the urgency is even greater. We all need to figure out how to navigate and adjust to these strange times. Our goal tonight is to address some of these concerns, and hopefully people can walk away feeling that they have a better handle on how to deal with certain situations. With me this evening are Jeff Wax and Jill Harkavy-Friedman, who are both professionals in the mental health field. They will serve as panelists and answer questions related to mental health and, as relevant, to hearing loss as well. So now I will introduce both Jeff and Jill.
Here we are.
Hello.
Picture it on there it is. Okay, great. Wonderful. So first I will introduce Jill. Dr. Jill Harkavy-Friedman is a clinical psychologist and Vice President of Research at the American Foundation for Suicide Prevention, also known as AFSP. Dr. Harkavy-Friedman leads their grant programs and works with researchers and organizations to develop and share strategies for suicide prevention. Dr. Harkavy-Friedman has published over 100 articles, and she works closely with AFSP's teams to develop effective programs and messages. As a licensed psychologist, she maintains a clinical practice in Manhattan. She is also on the board of CHC and chair of Comedy Night for CHC. Welcome, Jill.
Hi, Kate.
Hello.
Thank you so much.
You're welcome.
I'm really looking forward to this conversation. I want to just say a word about American Foundation for Suicide Prevention in case people have questions. The American Foundation for Suicide Prevention is the largest private suicide prevention organization. And our mission is to save lives and bring hope to those affected by suicide. And we do this through research, education, advocacy, and support for people affected by suicide. And you can go to our website, afsp.org, to find all kinds of helpful information. We know that about 50% of people have been affected by suicide. And as you mentioned, the rate of mental health conditions and hearing loss, we're talking about a large portion of people who may be having some questions and some thoughts. So I'm looking forward to helping in this discussion. I also want to say that I came to CHC when my now 32-year-old daughter, I hope she's 32, not 33, she'll tell me, was diagnosed with hearing loss when she was 2.5. And so I think CHC has been a very important part of our lives, and the whole mental health program there is outstanding. So thank you for having me. I look forward to the questions.
Wonderful. And now I would like to introduce Jeff Wax. Mr. Jeff Wax is the director of the Baker Family Emotional Health and Wellness Center and psychotherapist at the Center for Hearing and Communication and has worked at CHC since 2002. Mr. Wax has provided counseling services to people who are deaf or hard of hearing for over 20 years and has worked with clients of all ages, gender, sexual orientation, and hearing ability. He is also experienced as a field placement instructor and supervisor for graduate school interns and maintains a private practice. Welcome, Jeff.
Thank you. Thank you so much for everyone for being here. I'm really, really happy to be on the stage with Jill and with Kate. And please call me Jeff. Mr. Wax sounds like my dad. So I am the director of the mental health services, the Baker Family Emotional Health and Wellness Center at CHC. We are one of 3 clinical departments, mental health, audiology, and communication services, of course. We see people of all ages. We have, I think our youngest client is 5 now. Our oldest is 93. So we sit with people across the span of ages and hearing loss. We're all fluent in American Sign Language. We see people who are just sign language users as the main mode of communication, as well as oral communicators. And that's their preferred method. And I'm gonna not talk so much about that. Let's get to questions.
Yeah.
Okay, so here we go. So my first question, both of you sort of answered. I don't know if you maybe want to elaborate some more, but love to hear a little bit more about what you do in your area of work. And the second question, which might be more relevant right now, is Could you tell us a little bit about what this past year was like in terms of what you saw with your patient, in terms of emotional health and the issues that you observed? So if Jill, if you want to start with that.
Sure. So my work is focused on mental health and preventing suicide. So, a lot of times people hear research and they think they can't understand. So that is not true. Part of our goal at AFSP is to bring research findings to practice and to the public so that we develop a public that's smart about mental health and suicide prevention. I also work in terms of clinical trainings that we do to tune up and train up the clinical workforce to be able to work with people who are experiencing suicidal ideation or behavior and their families. It's not that long ago that we didn't have anything to help people who were thinking of suicide. And even mental health, we have so much more now. And mental health is health. And as we learn to take care of our mental health, we're also taking care of our whole person and our whole body. And there are things that we could do every day. We all have mental health. So what I've been doing and what I've seen during this time is that people have been out of their element. There has been more depression, more anxiety. I see the good thing is that people are reaching out. So it's not surprising to me that calls to mental health and crisis centers are increasing. I think that's a good sign because it means that people have hope and that they know there are resources there. In the olden days, people, for instance, thought that if somebody was going to kill themselves, there was nothing you can do. We know that's not true now, and just having a conversation can at least help a little bit. So we have so much more. And so I'm actually very happy that I'm not happy that people are anxious and depressed, but I'm happy that they're talking about it and seeking help. And many of the people who are reaching out just need some support and some ideas about how to manage their mental health. And many people who are reaching out need more intensive therapy. So this is what we're seeing. We started talking about mental health at the beginning of the pandemic, and I think that's been terrific. I myself have been setting daily goals and trying to include things like sleep, exercise, not so good on the exercise, eating properly, not that great on that either, but getting outside, setting goals for myself every day, breathing. And these are the things that I've been encouraging other people to do as well, to distract themselves from what's going on and to take care of physical and mental health.
I mean, one thing that that I've absolutely been seeing, that we've all been seeing, is this increase in need at our agency in my department. I think we've seen the latest number was something like a 40% increase. We've been working really hard, and we're really tired and really happy that people are reaching out. Jill, as you said, that's the upside. People are feeling some intense challenges in life, and they are reaching out. I have to say, I am also seeing people cope. And I am seeing people adapt, and I am seeing people react to the impact of the world with old negative responses that are coming up, and that can be really challenging. Anxieties that we thought we had a handle on all of a sudden are coming up more strongly. Definitely seeing a lot more anger and frustration. And of course, we know everybody out there who I can't see, but we're all reading about and or living with grief and loss and trauma. It's been all around us for this past year, if not in our individual lives, some of our individual lives before that. And I just want to say too that one of the challenges of this year, and really any time when something really large around us has happened, is that the safety valves in our lives, the structures in our lives get pulled away. I've seen clients that were doing pretty well. You know, we encourage, as therapists, we really encourage positive supports, do things like Jill, you started to mention, you know, the breathing or mindfulness or exercise, anything that keeps anyone going. And we've seen that taken away from people because everything's closed. And if we said, go join a group or go to the library or go to the museum, or, you know, people couldn't do that. So the impact of that has been pretty strong for most people. And we've definitely seen, as we're going to get to some specifics, I think, questions, we've definitely seen in our communities, in the community that I work with in most of the time, people with hearing loss, challenges with communication, people, troubles with finances, with food, stability, you know, all sorts of categories of people. Some people very lucky in life, some people less lucky in life, with more education, more financial resources for them. So we really have seen the gamut. I like to say sometimes in my department that the clients who come to us are the same people who we might read about in the newspaper, or the same or hear about in the news, and it's all of us.
And I certainly agree, and it's really pervasive in everything that we do and all the different activities that we're involved in or we can't do. So that's sort of a nice kind of overview. Question that I have, and maybe this is something that Jill might be able to answer, is what would you say are some signs of serious mental illness that people should be aware of?
That's a great question, and I can address it broadly now, but I do encourage you to learn more. So the first thing I would say is, if someone is different from how they usually are for a sustained period of time, maybe a few weeks, check in with them, because you can't just look at a person and know if they're having a serious mental health problem. So if somebody is showing something that's not like them, trust your gut and have a question. So what might you see? You might see trouble with sleeping too much or too little. You might see trouble with eating and weight loss or weight gain. You might see withdrawal from other activities and people that they typically enjoy. You will likely see at least subtle signs that they're not functioning as well, but people are pretty good at putting on, making things look like they're okay. And so it's also true that when people have a serious mental health condition, it can go on for longer than necessary because they're keeping it quiet. So again, if you can have a conversation with someone to see if they're having a prolonged problem. And I'm saying this because we're very forgiving of the people we know. We tend to say, oh, they're having a bad week. Oh, work is tough. Oh, the pandemic is so stressful. And so when we find ourselves saying that, then it's a good thing to go back and say, wait, what am I seeing? And let me just touch base with this person. Other signs of serious problems are substance use, increases in alcohol or drugs, or starting alcohol or drugs. In addition, you could see them looking on the internet, looking at very either aggressive or hopeless or kinds of things that they wouldn't normally look at. And then there are those really unusual experiences, like hearing things that aren't there, seeing things that aren't there, having thoughts that don't really make sense, or their train of thought is just, you can't follow it. Whatever you see, take a deep breath. I'm going to be saying that a lot, and then have a real conversation with them. And it's okay to also gather information from their friends and other family members to see if they're seeing it too. But it's important to act like you're the only one who's going to ask them.
Right.
And even when people are doing well, it's important to check in, because they may be working super hard behind the scenes to put on a face that they're fine.
And Jill, we also do that for ourselves, right?
Yep.
I mean, we either put on a good face, or we're strong and we're gonna like muscle through a situation. But so many of if not everything you just said applies to ourselves, right? When you're noticing in yourself, you're not going to work, or it interrupts school, or anything that interrupts everyday life to an extent. I use Jill said this as well, but I use the words frequency and intensity. You know, every therapist will say, "How are you doing?" And the person explains what's going on. And then many times the next question is, well, how long has this been going on, right? If you feel like you're in an emotional state and an experience that feels stuck, that feels you're kind of mired in it and it's not moving, you know, that's also a sign, a good time perhaps to reach out for other supports. I want to add in the words emotional flexibility, that we want to, I think we all want to live with emotional flexibility. Some of the words, all of the words around emotions that we're talking about, we're all experiencing. You know, these feelings are natural, feelings are normal. Everyone's angry, everyone gets sad, this is all part of life, but we don't have to get stuck in them, and we want to live through them. Right. So have that emotional flexibility. The other side of it, if you find yourself or think of yourself, I'm not doing so well with that, again, that might be the time to get help and talk it through.
Mm-hmm.
Yeah. And I would say too that as much as possible, it's so important to have pre-existing supports in place.
Oh, yeah.
You know, if one can identify a close parent, a close sibling, or a really, really good friend that they feel they can really open up to and not feel embarrassed or ashamed, it's so key. Because once you talk about it, it gets out, it gets normalized more, and the other person can help you get the help that you need.
Yeah, one thing I want to say though is that when someone is depressed or they don't have the flexibility in thinking to find alternatives or to use their usual coping strategies, they often feel, and this is one of the lenses of depression and anxiety, that nobody can understand them, or they're a burden, so they're not going to go talk to people, or that you know, they're just so different from what they were like that they don't want to show people. And so it's very hard when you're not feeling well to reach out for help. And one of the things we're trying to teach people is, even when you feel the worst, please reach out for help. But as a friend or a family member, we can reach out to them before they reach out to us, so things don't get to a crisis point. So I think having compassion and respect, well, my 4 words: compassion, respect, patience, and persistence. And sticking with the person. If you're seeing something and it's not working, come back to them another time. If they say, "Oh, I'm fine, I'm good," don't give up on them. Keep trying.
That's right. We never want to give up on our patients, you know, especially when we know that they're struggling. So another question that might be something for us to think about is, maybe might be something for Jeff to answer, is, so let's say someone comes in and they say that they feel really depressed, and or they meet you outside of CHC and they want to get help for themselves. What would be the way to go about that?
Well, it's certainly talking to people, getting in touch with resources. At the end of the beginning or at the end of the webinar, my contact information is there. Feel free to contact. What we were saying a minute ago around noticing if something is off, you're not feeling yourself. You know, those are all signals to reach out. Where to reach out is, you know, there's a lot of resources online for sure. You could certainly contact me. I have other contacts. finding a therapist is sometimes not an easy task. Sometimes right now, because people are so busy and schedules are so full. I know I try to get people in as soon as possible, at least to at least talk with people, see what's going on, for sure. But there are resources out there for sure. Yeah.
Can I add something to that, which is
Sure.
that we have a whole several parts of our website that offer ideas about how to get help. So if you go to afsp.org and you put in find help or mental health resources or minority mental health resources, we have all kinds of contacts that you can reach out to find therapy. But like Jeff says, you know, it's a process. It's not like you find a number, you call it, they say, okay, right now, let's have a session. It takes time, and you might have to try a few people before you find someone that's available and right for you.
Right. I just want to piggyback on that also, because I think in our field, and Kate, you certainly have experienced this as well as a physician. Resources for ASL, culturally deaf folks, and the hard of hearing community are even not so readily available. It's really, really unfortunate in our world that a lot of services have either gone by the wayside or have been that are really shrunken down. You know, CHC is we're one of two mental health services specifically for our population, deaf and hard of hearing folks, the other being Lexington Mental Health in Queens. We're both pretty small. I'll put a plug in for them. They're terrific folks over there, really wonderful clinicians, but we're small. However, all of that being said, one thing to look for in a therapist, and I'm sure many of the people out at home know this, but just to remind, find someone who really knows not only what you're dealing with in terms of emotional health issues, but in terms of using your language, knowing about hearing loss. I can't tell you, I think the three of us have known this and hear these stories where people might have found a good therapist, but they don't understand anything about hearing loss. And super important that you hook up with somebody, that you connect with somebody who really understands that. You live the nuances and the frustrations and the joys and what all of life around dealing with hearing loss, and deserve someone who understands that.
That's right, and it can be pretty difficult. So we do have some live questions that I would love to pose for you. One question is, I'm concerned about those who are graduating during this pandemic. They've missed out on a lot. I have two nephews graduating. One is bipolar. What special problems might this pose for him?
So I think, you know, obviously I can't answer directly. Oh, I'm just taking this up like you were asking me. I just realized that. But I think one thing to realize is, well, we can't tell you specifically about your nephew, but if he is sustaining a therapeutic relationship with someone, and often with bipolar, medications is an important part of that program. So if he's maintaining his mental health and optimizing it as much as possible, it's important for people with mental health conditions to be their own advocate and to understand and this is for anybody who has anybody really, to understand what you can do and what you can do. What is your capacity? Do you work better with people or without people? Do you work better working part-time or full-time? Do you need to work at a place where people don't really talk to each other because it's too overwhelming for you? Or can you work at a place where, you know, there's lots of group work? So and the truth is that college students don't really often have much experience. So they're going to be tested. They're going to be pulled in different directions. And finding your way in life means a lot of failures and a lot of missteps, along with the really positive. So I think staying hopeful, paying attention to what you can do, taking care of your mental and physical health along the way, allowing yourself some of that flexibility to have bumps in the road, because there will be, are key. And then having the supports around you, which I think has come up quite a few times now, and what I call your entourage. So people and places that can provide the support you need. So if you have a mental health condition, right, that involves your primary care physician or your primary care clinician. It may involve your psychiatrist, your therapist. It might involve your dentist, for all we know. It might involve the guy on the corner that you get your coffee with and you chat with him and you feel centered every day. So build a network of people. It also means that you're not reliant on just one person, so that if you need something and somebody's not available, there will be somebody else who can help you. So I think especially as you're leaving college. A second thing is build your repertoire of things you can do that help you to stay healthy and well. And the third is to maintain your resilience reservoir, because we all have a certain capacity, and if we only allow it to drain and never allow for refilling that capacity, at some point you're going to be dry, you're going to be in a drought. And so it's always important to keep building your resilience capacity. Sometimes it's with very small things like taking a shower or going for a walk. Sometimes it's with big things like getting more education or changing jobs. But it's very important to be aware of your resilience capacity, what's draining it, and how you can fill it. And then pay attention to what you can control and try to let go of the things you can't control.
Right. One of my thanks. One of my favorite words, my staff knows this well of me, are the word safety and control. And Jill, exactly as you said, when we all need a sense of control and a sense of safety, and when that gets bollocksed up, we need to add it back in. The replenishment is really, really important. I want to just take a minute, if I can, to expand on the question around, it was specifically around college age, but I want to just mention around younger age and kids. And one of the things to really do, whether it's little kids or even older kids, or adults for that matter, but validate their feelings, validate what's happening. I think part of the question was around disappointment, graduation, and graduation even this year is not going to be the same or similar as it was last year, right? And it's not going to be, hopefully, the same as it's going to be in next year or the year after, but validate those experiences. There's a disappointment that's happening, right? And it's real and it's happening, and just to acknowledge that and to know that, and especially with younger kids, you want to join with them and comfort. Think of creative ways around graduations. My nephew is graduating college, and there's going to be a home backyard graduation ceremony, and it's being planned. And so that's the creative part that I was saying earlier. I'm seeing a lot of creativity and a lot of adapting to situations, and they can be pretty special. We make like a ceremony, like a graduation. They can still be pretty special, even though they're not the same. Kate, you work with this population, the college kids, right? What are you seeing?
Oh my goodness. Well, as you know, and what I've mentioned earlier, it's an extremely exceptional year. The class of 2020 never had a graduation. And they were supposed to come back this May to have a real graduation, and that got canceled. And so they really got like, the short end of the stick. And so they had a virtual graduation, and then reunions was canceled at Princeton. So any kind of get together
I think we're losing her.
You know,
I'm guessing she'll be back.
out of the question. So it's a
Well, I think that while she's getting her internet together, that I think we pretty much established that this is a year like no other. And there's going to be disappointment and discomfort, but there's opportunity to really do it in a different way. You can't make up for it. You have to acknowledge it, but you don't have to be sunken in. You don't have to do nothing.
Right. And those ways I was saying before around, they can still be special and experiences of note. They become part of our history as well, right? A family history, you know, remember the time we had that backyard graduation, you know, and they form into something else. They don't, you know, the disappointment morphs into something else, hopefully. You know. Do we have Kate back?
I was Kate. We can't tell if you're with us or not, but maybe we could take a look and see if there's some other questions in the question and answer while we're waiting for Kate to come back. And one of the questions that I see is, do you have any statistics for people who have a mental health issue versus people with hearing loss and a mental health issue? Is there a difference? Does hearing loss impact mental health? So I think we both probably have something to say about that. Do you want me to start, Jeff? Or
Sure.
you want to go ahead? Okay, so I have to start by saying we don't know a lot about mental health in the deaf and hard of hearing communities. There has been very little research, but the research that has been done shows that just like people who don't have a hearing loss and who are not deaf, you know, mental health conditions happen. It doesn't look like there's evidence that that mental health conditions happen at a greater rate among people. Now we're talking generally, people who are deaf or hard of hearing. They don't seem to show more of some, say, depression or anxiety, except the condition of tinnitus, where there is an increase in depression and even suicide. So if you know someone who has tinnitus and is suffering with it, there are interventions both for the tinnitus and for the depression and thoughts of suicide that can make all the difference in the world. So we need a lot more research in this area, and also to think not all levels of deafness and hearing loss are the same. And just like in any other group, there's no one thing for everybody. So we need to learn more about this question. But so far, it doesn't look like there's an increased risk. But again, what about somebody who becomes deaf in their 40s versus somebody who's been deaf all along? You know, we develop, and a lot of times what happens is these kinds of transitions or changes are stress points for mental health conditions. And it's really important to pay attention to your mental health, or the mental health of the one you care about who's going through that. Jeff,
Right.
you want to?
Right. Yeah, just to add in, we often get a similar question around, does deafness or does hearing loss cause fill in the blank, cause depression, cause anxiety? And really the answer is no. However, there are people living with hearing loss, living in the mainstream hearing world for sign language users. There are communication barriers, right? These can cause frustrations and anger and all sorts of similar reactions. And living in a world where technology is so much more sophisticated than ever before, that's fantastic, but there's still a lot of barriers that the ADA, for example, was supposed to, you know, take away those blocks. And I rant and rave to people, you know, we're how many years after the ADA, and people are still, corporations, companies, facilities are still not complying with. So I certainly see people in my practice who, even if, say, for example, working for a company that has the means to get the equipment, and then they don't. And so people, and I don't have to tell a lot of people who are living this, who are at home, it's exhausting. You know, this plugs right into what Jill was saying earlier. Fight the good fight, because it can be really energizing. Advocate, it's fantastic, but make sure that you replenish, because fighting the good fight is depleting, right? Sometimes I use this phrase that we want to take on the fight of the world, but you also want to fight the fight in your world, for your world, you know, the world that you inhabit, right?
Mm-hmm. Yeah. Welcome back, Kate. We missed you.
Thank you. I don't know. I just blacked out, I guess. So I have a question that maybe Jeff might be able to answer, if I may, from the audience. My daughter is 23 years old and deaf, and I think it would be helpful for her to see a therapist. If I tell her, she feels I'm telling her what to do, and she gets upset if she feels like I'm telling her what to do, and she gets really angry. Any suggestions?
Don't tell her what to do. It's tough. It's tough. And as a parent or anybody we're close to, and we see that there are issues going on, and you so want to be supportive and help. And I would say one suggestion is to make sure that there's access to help, and provide that. As Jill mentioned earlier, when you're in the throes of an emotional experience where you're stuck, where you're perhaps overwhelmed, exhausted, whatever, you don't have the willpower all the time to reach out. So certainly providing those resources. There's a lot more resources now than ever. The upside, I hate that phrase, but the upside of the pandemic in our field is telehealth and teletherapy. So a lot of our practice now has been in, you know, Zoom-like platform calls and teletherapy. It's really effective. It has been very connecting for people. Perhaps for your daughter, you know, not leaving home, it would be really supportive. Staying at home, it's safe, being in that safe place and making a phone call. You know, it can also be, I mean, just around telehealth versus actually going into an office, because it can be pretty daunting and a little scary. This can feel very connected, can feel very intimate, and maybe less threatening. So that might be a way to get someone connected. I think also, just off the top of my head, not to make it sound so daunting, you know, therapy, and people go into therapy for all sorts of reasons, obviously to deal with difficult emotional challenges, but also people go into therapy to explore their lives, you know, grow. I want to change something in my life. It's not so dire, but I've really been bugging this. I don't want to have the same kind of relationship I had before. And what do I do about that? And go to a therapist to help support that process. So, you know, perhaps suggesting doesn't have to feel so serious. I often will, I just want to see a person one time. And in that one time, I want to talk to them like we're talking, you know, that I'm a person, I'm a nice guy, you know, I'm smart and all of that, I hope, but, you know, I want to relate to the person and what they're going through. And so often, if you have that one experience, that time leads to other times, leads to other sessions, you know, and taking away some of that stigma and some of that fear.
Yeah, and you know, Jeff, that was really great what you said. I also want to add a couple of thoughts. You know, sometimes when you tell somebody that you think they should go into therapy, they think that you think there's something wrong with them, or that, you know, it's like a punishment, or don't talk to me, talk to a therapist. You know, there's all kinds of interpretations of what that means. So you might ask a person that you want to get into therapy, what do you think I'm saying when I suggest that you get in therapy? What do you think therapy is like? What do you imagine? I'm recommending it because I care about you and I love you and I see that you're in pain, or that you might want to tweak your life a little bit. The other thing is, it's often helpful for family members to either get into therapy themselves to work on this. You know, it's not like you're going to say something and then suddenly your family member is going to go into therapy. So working with a therapist about ways to approach the person that you're caring about, and the impact that it has on you, because often when you have a family member who's suffering, it affects everyone around them.
Sure.
The other thing is there are groups that are often in communities available where you can speak with others who have had a similar situation, and then you can maybe get some tips. You can also offer to go to family therapy. I mean, that's why I think often it helps if a person wants to help someone, in addition to our great guides to how to have a conversation, because it is important to not be judgmental, to listen, to not try and solve the problem for them or even identify the problem for them. Because the goal is to find out what they're experiencing. And that's how you figure out how to help them. So it's really about asking and listening. So the guides that we put in the chat can be really helpful for that. But just compassion and just not being judgmental can really go a long way, and just understanding what it's like for that person.
Jill, I love what you just said about not having to solve the problem. You know, the therapy and so many practices in life, I like to call them practices, like a yoga practice or an exercise practice, that emotional learning and emotional well-being is also a practice, and it's a process. You know, when we look for, we look to be in the process, not necessarily that the process has definitely an immediate result. It often doesn't have an immediate result or answer. And if we only want the answer, we're missing out on so much.
Yeah.
So
I know we're running out of time, so I'm wondering if we have another question in the meantime. One last question.
So we have, yes, that's right. Maybe we're time for one more question. There's a question about suicide prevention. So I will ask you, Jill. After learning a friend or family member is suicidal while waiting with them to get help, if there's something to say better than there is hope, I feel like I should give them reasons to live, but I don't know if that's right.
You know, that's a great question. And I think when somebody is thinking of taking their lives, first of all, it can be very scary. And it's scary because you don't want them to, and it's out of your hands, it's in their hands. So again, we're talking about compassion, respect, patience, and persistence. So yes, start off, once you find out they're having suicidal ideations, which may not be the first thing that you find out. People don't necessarily just blurt that out. But once you know someone's thinking about suicide, I think the key is to listen to them and find out what is making them feel so much pain that they want to end the pain, because that's often what happens with suicide. And so I think you start with what's going on. That is there anything in particular that's leading you to feel this way? What have you tried? What can I do to help you, so that, because I believe this at some point will pass and together we can work on this. Or I believe I know that if you get help, and I'll help you in any way I can, that this will pass and you'll find ways to find a life worth living again. Because in that moment, a lot of times people aren't thinking of taking their lives. They're just thinking, I am in such pain, I just want it to stop. And I think appreciating, I hear that you're in a lot of pain. What have you tried? There are people who can help. Can I help you get help? Just talk to me and I won't try to fix it for you. I just want to understand what you're feeling because you're important to me. And I think that this is a really hard time.
That's right.
And it's okay to say, it's okay to have hope too. You can't tell a person, well, you shouldn't feel that way, or, you have lots of things to stay alive for, but rather try to find for them, is there something that they can come up with to keep them going? But it's if you understand what they're thinking and feeling, then you can figure out, is this an emergency? Or is this something that we can, get a therapist involved, or a psychiatrist, a medication, at least get an evaluation. Not every time someone is thinking about suicide is not an emergency. So it's important to understand and find out what they're thinking and feeling before you can know what to do for them.
Well, thank you. I think we'll need to wrap up now because we're out of time. And I want to thank Jeff and Jill for their wonderful contributions to this very important topic of mental health and hearing loss as it was relevant. And I apologize for the internet disruption. I switched over to my cell phone, so it's a little bit better now. But now we're ending. I will now hand things over back to Carolyn Stern, who will now be also putting up resources and links on your screen. Thank you.
Thank you so much.
Thank you.